Have you ever watched an elderly person sort through their daily pills, morning pills, afternoon pills, evening pills, sometimes a dozen or more scattered across the kitchen counter like pharmaceutical confetti? We've been taught that more medicine means better health, especially as we age. But what if I told you that some of the most common medications sitting in your medicine cabinet right now could be slowly poisoning you? What if the very pills prescribed to help you are actually increasing your risk of falls, kidney failure, or even death? And what if the most dangerous one of all is something nearly every senior takes without a second thought, something their doctor probably described as perfectly safe? Most people don't realize that an aging body processes medication completely differently than a younger one. It's like trying to run modern software on an old computer. The hardware just can't handle it the same way. The liver slows down. The kidneys work less efficiently. What a 30-year-old can clear from their system in hours might linger in an 80-year-old's body for days, building up to dangerous levels. This isn't just about one or two pills. It's about what doctors call polypharmacy, when multiple medications interact inside a senior's body in ways that can be devastating. Each additional medication doesn't just add risk, it multiplies it. A Centers for Disease Control and Prevention report reveals that 83% of Americans aged 60-70 had taken at least one prescription medication within the past month, with approximately 1/3 using 5 or more medications. Cholesterol-lowering drugs, blood pressure medications, and diabetes treatments were the most frequently prescribed. Today I'm going to reveal the 7 most dangerous medications for people over 60, medications that can literally act like poison in aging bodies. The most shocking one is number 1 on this list, something almost every senior takes without question. But before we begin, show your support by liking and subscribing to the channel so we can reach more people. Do you know an elderly person who takes multiple medications? Leave your comment below. 7. The inflammation time bombs, NSAIDs. Let's start with something hiding in almost every home. NSAIDs, or non-steroidal anti-inflammatory drugs. We're talking about ibuprofen, naproxen, diclofenac, the pills people pop for headaches, muscle pain, or arthritis. They seem harmless because you can buy them at any gas station without a prescription. For seniors, these are ticking time bombs. Think of an elderly person's stomach lining like tissue paper. Every dose of an NSAID is like pressing a needle against that paper. Chronic use literally tears holes in the stomach, creating ulcers that can rupture without warning, causing life-threatening internal bleeding. I've heard countless stories of families finding their loved ones vomiting blood, not understanding how someone who seemed fine hours earlier could suddenly be dying. But the stomach damage is just the beginning. NSAIDs attack the kidneys by restricting blood flow to these vital organs. Since kidney function already declines with age, this double hit can push seniors into sudden kidney failure. Many elderly people end up on dialysis not because of diabetes or high blood pressure, but because they took harmless pain relievers for years. If your elderly loved one has high blood pressure or heart problems, NSAIDs make everything exponentially worse. They interfere with blood pressure medications and can trigger heart attacks or strokes. It's a triple threat: stomach, kidneys, and heart, all under attack from pills most people consider safer than aspirin. The tragedy is that safer alternatives exist. Acetaminophen, when used properly, can provide similar pain relief without destroying internal organs. But most seniors don't know to ask, and many doctors forget to explain the alternatives. 6. The zombie pills, benzodiazepines. Benzodiazepines are the medications seniors often call their nerve pills: clonazepam, lorazepam, alprazolam, diazepam. They're prescribed for anxiety, panic attacks, and sleep problems. They work by slowing down brain activity, which sounds helpful for someone who's anxious or can't sleep. But here's the deadly secret. These drugs stay in elderly bodies far longer than they should. An aging liver processes these medications at a snail's pace. While a younger person might feel drowsy for a few hours, a senior can be impaired for days. The result? Elderly people on benzodiazepines walk around like zombies. They're dizzy, confused, and their coordination is shot. They look and act drunk without touching a drop of alcohol. For a senior, this isn't just embarrassing, it's potentially fatal. Falls are one of the leading causes of death in elderly people, and benzodiazepines increase fall risk by hundreds of times. But here's what makes this particularly cruel. The symptoms often get misdiagnosed as dementia. When an 85-year-old becomes confused and forgetful, everyone assumes their brain is deteriorating. Families grieve for months watching their loved one decline, never realizing that adjusting medications can restore their mental clarity. These drugs should only be used in rare, exceptional cases and for very short periods. If someone you care about seems constantly sluggish, dizzy, or confused, check their pill bottles. The answer might be hiding in plain sight. 5 anticholinergic medications. This category will shock you because it includes medications people use every day: cold medicines, allergy pills like Benadryl, motion sickness drugs, sleep aids, and even some antidepressants. These seem completely harmless. You can buy most of them at any pharmacy without a prescription. But they all share a hidden danger: anticholinergic effects. These medications block acetylcholine, a crucial brain chemical responsible for memory, thinking, and movement. In seniors, this creates symptoms that are virtually identical to Alzheimer's disease. The elderly person suddenly becomes confused with terrifying memory loss. They can't remember conversations that happened minutes ago. Their vision becomes blurry, their mouth goes dry, they become severely constipated, and they have trouble emptying their bladder completely. Family members panic, thinking they're witnessing rapid cognitive decline. But sometimes it's just the medication they took for a stuffy nose. What makes this especially insidious is that these effects are cumulative. Seniors often take multiple medications with anticholinergic properties without realizing it. The sleep aid contains the same ingredient as the allergy pill, which has similar effects to the antidepressant. Each one compounds the others, creating a perfect storm of cognitive impairment. Always ask doctors, does this medication have anticholinergic effects? Is there a safer alternative? Most of the time, the answer is yes. 4. Digoxin. Digoxin is prescribed for heart failure and irregular heartbeats. It's supposed to help the heart beat stronger and more regularly, which sounds exactly like what someone with heart problems needs. But for seniors, taking digoxin is like walking a tightrope over a canyon. Elderly bodies eliminate digoxin incredibly slowly. It accumulates in the system like water filling a bathtub with a clogged drain. What should be a helpful dose quickly becomes a toxic one. And the difference between therapeutic and lethal levels is razor thin in elderly patients. The early warning signs are subtle and easy to dismiss. Nausea, loss of appetite, fatigue. Most people attribute these to normal aging or other health conditions, but as digoxin builds up, more serious symptoms emerge. Seniors start seeing yellow halos around lights, a classic sign of digoxin toxicity. Then come the dangerous heart rhythm abnormalities, some of which can be fatal. What makes this particularly tragic is that there are now much safer heart medications available for most conditions that digoxin treats. But many seniors continue taking it simply because they've been on it for years and no one has thought to reevaluate whether it's still necessary. If someone you love takes digoxin, make sure they're getting regular blood tests to monitor levels. Better yet, ask their doctor, is this truly necessary? Are there safer options available? 3. Sulfonylureas. Older diabetes medications like glyburide and glimepiride work by forcing the pancreas to release insulin, whether the body needs it or not. In younger people with predictable eating schedules, this might work reasonably well. For seniors, it can be brutal and sudden. Elderly people often have irregular eating patterns. They might skip breakfast because they're not feeling well, eat a smaller lunch than usual, or forget to eat altogether. But these medications don't care. They force insulin release anyway. When insulin floods the system without adequate food to match it, blood sugar crashes dangerously low. Hypoglycemia in seniors doesn't look like what most people expect. There's no dramatic sweating or shaking that might alert someone to danger. Instead, the senior simply becomes confused and weak. Family members often think they're witnessing a stroke or dementia progression, when actually it's a medication-induced emergency that could cause permanent brain damage or death if untreated. The good news is that modern diabetes medications work much more intelligently. They only stimulate insulin release when blood sugar is actually high, dramatically reducing the risk of hypoglycemic episodes. Ask your loved one's doctor about switching to safer alternatives like metformin or newer medications. Before we continue, I've got some exciting news to share. If you enjoy our content and want access to exclusive benefits, become a channel member. As a member, you will unlock some amazing perks like early access to new videos, priority replies to your comments, members-only shorts, polls, quizzes, and special emojis and loyalty badges just for you. Just click the join button and be part of this community that values health and well-being. Your support helps us keep bringing high-quality content for you. 2. Zolpidem. Zolpidem, sold as Ambien and other brand names, represents everything that can go wrong when medications designed for younger adults are prescribed to seniors. It's remarkably effective at inducing sleep, which seems perfect for elderly insomniacs. But seniors metabolize Zolpidem much more slowly than younger people. While the drug is supposed to wear off by morning, elderly users often wake up still significantly impaired. They're dizzy, confused, and unsteady, a perfect recipe for a devastating fall in the dark. Even worse, Zolpidem can cause terrifying sleep behaviors in seniors. They might cook entire meals, clean the house, shop online, or even drive cars while essentially sleepwalking, with absolutely no memory of these activities the next morning. For someone living alone, this creates extremely dangerous situations. This medication should be an absolute last resort for insomnia in seniors and only for short-term use. The underlying sleep problems are often caused by other factors: pain, anxiety, side effects from other medications that could be addressed more safely. Number 1. Proton pump inhibitors. The most dangerous medications of all are the ones that seem most benign. Proton pump inhibitors like omeprazole, pantoprazole, and esomeprazole. These are everywhere in elderly households. People think they're harmless stomach protectors, but that's a dangerous myth. These medications work by essentially shutting off stomach acid production. That might sound reasonable for someone with ulcers or severe heartburn, but stomach acid serves crucial purposes. It kills harmful bacteria and helps absorb essential nutrients. When seniors take these medications long-term, they become sitting ducks for serious infections. Without adequate stomach acid to kill harmful bacteria, they're vulnerable to Clostridium difficile, which causes uncontrollable diarrhea that can be fatal in elderly people. They also face increased risks of pneumonia and other infections. But the damage goes deeper. These medications cause severe vitamin B12 deficiency, leading to anemia and neurological damage that looks exactly like dementia. They interfere with calcium absorption, making bones fragile and increasing fracture risk. They can cause kidney problems and may even accelerate actual dementia. The most tragic part? Many elderly people who've been taking these medications for years no longer need them. They started taking them for a specific problem that resolved long ago, but they continue out of habit. Their doctors assume they're still necessary and never suggest stopping them. Most elderly people don't actually need long-term acid suppression, but they keep taking these drugs because no one ever questions whether they're still necessary. The fundamental problem is that we treat elderly bodies as if they're just older versions of young bodies. But aging changes everything about how medications work. What helps a 40-year-old can poison an 80-year-old. Every medication should be regularly questioned. Is this still necessary? Are there safer alternatives? Are the side effects being mistaken for normal aging? Sometimes the best treatment isn't adding another pill, it's removing one that's causing more harm than good. If you know an elderly person taking multiple medications, help them create an updated list of everything they take, including over-the-counter drugs and supplements. Schedule regular medication reviews with their doctor. Ask hard questions about each prescription. The medicine cabinet doesn't have to be a death trap, but protecting the seniors we love requires understanding that when it comes to medications and aging, less is often more. Which one from our list are you taking? If you found this video helpful, please type yes in the comments below. Also, show some love by liking the video and subscribing to the channel. It helps us to reach more people. Thanks for watching.